1. Which of the following is the primary role of an LVN in patient care? A. Diagnosing medical conditions. B. Performing surgical procedures. C. Providing basic nursing care under RN or physician supervision. D. Prescribing medications. Two. What is the normal range for an adult's resting heart rate? A. 40 to 60 BPM. B. 60 to 100 BPM. C. 100 to 120 BPM. D. 120 to 140 BPM. Three. Which of the following precautions should an LVN take when handling a patient with tuberculosis or TB? A. Standard precautions. B. Droplet precautions. C. Airborne precautions. D. Contact precautions. 4. Which electrolyte imbalance is most concerning for a patient with renal failure? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyponatremia. Five. When administering a subcutaneous injection, which needle size is most appropriate? A. 18 gauge, 1.5 inch. B. 20 gauge, 1 inch. C. 25 gauge, 5/8 inch. D. 30 gauge, 2 inches. 6. Which of the following symptoms is most indicative of hypoglycemia? A. Dry skin, fruity breath, and polyuria. B. Sweating, confusion, and tachycardia. C. Bradycardia, hypertension, and pale skin. D. Edema, oliguria, and confusion. 7. A patient with heart failure is prescribed furosemide or Lasix. What should the LVN monitor closely? A. Sodium levels. B. Potassium levels. C. Blood glucose levels. D. Hemoglobin levels. 8. Which type of isolation is required for a patient with Clostridium difficile or C. diff infection? A. Airborne. B. Droplet. C. Contact. D. Reverse isolation. 9. A patient reports severe pain at an IV insertion site with swelling and redness. What is the LVN's best action? A. Apply heat and continue the infusion. B. Flush the IV line with saline. C. Discontinue the IV and notify the RN. D. Increase the IV flow rate. (10) Which of the following is an early sign of hypoxia? A. Cyanosis. B. Bradycardia. C. Restlessness. D. Hypotension. (11) The primary site for an intramuscular or IM injection in an infant is A. Deltoid. B. Gluteus maximus. C. Vastus lateralis. D. Dorsogluteal. (12) A patient with COPD should receive oxygen therapy at what flow rate? A. 1 to 2 liters per minute. B. 3 to 4 liters per minute. C. 5 to 6 liters per minute. D. 7 to 8 liters per minute. (13) A patient with right-sided heart failure is most likely to exhibit A. Pulmonary congestion. B. Peripheral edema. C. Orthopnea. D. Hemoptysis. (14) The best way to verify proper placement of a nasogastric or NG tube is by A. Injecting air and listening for sounds. B. Observing gastric contents. C. Measuring tube length. D. X-ray confirmation. (15) Which of the following medications is a loop diuretic? A. Metoprolol. B. Furosemide. C. Spironolactone. D. Lisinopril. (16) What is the correct hand hygiene protocol when leaving a patient's room on contact precautions? A. Hand sanitizer. B. Alcohol wipes. C. Soap and water. D. Glove removal is sufficient. (17) A patient is experiencing an anaphylactic reaction. What is the priority intervention? A. Administer diphenhydramine. B. Provide oxygen. C. Administer epinephrine. D. Monitor blood pressure. (18) Which vital sign change is expected in a patient with dehydration? A. Bradycardia. B. Hypotension. C. Decreased respiratory rate. D. Hypothermia. (19) The safest site for an IM injection in an adult is A. Deltoid. B. Dorsogluteal. C. Vastus lateralis. D. Ventrogluteal. 20. When administering digoxin, which parameter should be checked first? A. Respiratory rate. B. Apical pulse. C. Blood glucose. D. Oxygen saturation. (21) Which assessment finding is most concerning for a patient with pneumonia? A. Fever of 101 degrees Fahrenheit. B. Cough with sputum. C. Oxygen saturation of 88%. D. Rhonchi sounds. LVN. A licensed vocational nurse or LVN is a healthcare professional who provides essential nursing care under the supervision of a registered nurse or RN or a physician. LVNs are responsible for monitoring patients' vital signs, administering medications, assisting with personal hygiene, dressing wounds, and ensuring patient comfort. They work in various healthcare settings, including hospitals, nursing homes, clinics, and home healthcare environments. LVNs play a crucial role in patient care by offering hands-on support, educating patients and families, and reporting changes in a patient's condition to the healthcare team. Their training typically includes coursework in anatomy, pharmacology, and patient care, along with clinical experience. LVNs must be licensed by passing the National Council Licensure Examination for Practical Nurses or NCLEXPN, ensuring they meet the necessary standards for safe and effective nursing practice. Here are 5 top beneficial uses of LVN. 1. Direct patient care. LVNs provide hands-on nursing care, including monitoring vital signs, assisting with daily activities, and ensuring patient comfort, which is essential for recovery and overall well-being. 2. Medication administration. LVNs are trained to administer medications, including oral, topical, and some injectable drugs, under the supervision of an RN or physician, ensuring patients receive the correct treatment. 3. Wound care and basic medical procedures. LVNs play a crucial role in wound care, dressing changes, catheter care, and other minor medical procedures that help prevent infections and promote healing. 4. Support for healthcare teams. LVNs serve as a bridge between patients, RNs, and doctors by providing updates on patient conditions, assisting in medical procedures, and ensuring smooth coordination in healthcare settings. 5. Patient education and emotional support. LVNs educate patients and their families about disease management, post-hospital care, and lifestyle adjustments while also providing emotional support to enhance the patient's quality of life.